Doctor, you mentioned dislocation? Yes, dislocation. What is dislocation? It is a displacement of a bone from its natural position in a joint. Doctor, what is fibrositis? It is a muscular rheumatism, a periarthritis, or a periarticular fibrositis. Is that a rheumatoid condition, doctor? Yes, it is, and it affects the muscles and tissues around the joints. Doctor, we mentioned before the hallux malleus. Yes, the hammer toe. And what is a scoliosis? It is a lateral spinal curvature. What is spondylitis? It is the inflammation of one or more or several vertebrae. Doctor, what did this condition exist in the patient? It was not spondylitis, it was spondylolisthesis, which is a forward slipping of a lumbar vertebra on the adjacent vertebra below, usually associated with pelvic deformity. Doctor, is it different from spondylosis? Well, spondylosis of the vertebrae, also any degenerative lesion of the spine. I did not go into that yet. Doctor, was it a sprain? It was an injury to the joint with a tearing of the tendons and ligaments. Is that called talipes? Yes, talipes or clubfoot. Was there a subluxation? No, a subluxation was not present, if you define subluxation as an incomplete dislocation. Doctor, was there any arthrochalasia? Yes, there was arthrochalasia, which is a surgical breaking of a stiff joint. And the artificial ankylosis is called what? That is an arthrodesis. This arthrodesis is a surgical fixation of a joint to immobilize the joint. And arthrolysis? Arthrolysis is the freeing of the joint from the fibrous bands or excess cartilage to restore its mobility. Doctor, what is an arthroplasty? An arthroplasty is a surgical repair of a joint. The hip, knee, elbow, and temporomandibular joints are best suited for reconstruction. And these are arthroplasties, are they? Yes, arthroplasties of the hip joint. And the low friction arthroplasty was what? Well, this was not a low friction. This was a total hip arthroplasty or a total hip replacement. And an arthroplasty is of a temporomandibular joint in this case? Yes, the surgical breaking of a stiff joint to relieve a disabling ankylosis caused by rheumatic, degenerative, infectious, or traumatic arthritis. And doctor, does the mandibular condyle become resected? Well, it is resected and remodeled on the surgical place. And doctor, arthrotomy is what? Arthrotomy is the surgical opening of a joint. And a bunionectomy? A bunionectomy is the surgical correction of a valgus deformity, which is the removal of bony prominences, that is, the bunion, from medial aspects of the first metatarsal head. And chondrectomy? Chondrectomy is the removal of a cartilage. Doctor, what is the arthralgia in this case? Well, the joint pain was intense. And was there capsular laceration? Yes. You mean a tear of a joint capsule? Yes. Well, yes, there was crepitus also and articular grating of the joints. Was there a detachment of the cartilage? Well, there was a separation of the cartilaginous material from a joint. Loose bodies limit motion. And an effusion? Yes, a hemorrhagic effusion or bleeding into the synovial sac. Doctor, what is Heberden's nodes? They are hard nodules at the distal phalangeal joints of the fingers in osteoarthritis. And lipping? Lipping is the lip-like bony growth at the joints in osteoarthritis. Doctor, the marginal lipping of the acetabular rim was present in this case? Yes, it was, as well as the head of the femur in degenerative hip disease. Doctor, what is lumbago? Lumbago is the dull, aching pain in the lumbar region of the back. And was there a latissimus dorsi involved in this case? Yes, the latissimus dorsi, as well as the brachii. There's a